I'm Ellie. I'm from the Joint Commission. I'm here serving Scott Boulevard today. How are you?
Good. How are you?
Good. Good. I got a quick question if you've got time.
Yeah.
Awesome. So, what would you do if a patient presented who was actively suicidal or was threatening to harm themselves?
Okay. We have a guideline for that. If we had a patient who was actively suicidal that showed up to our building or threatening to harm themselves, we would not leave the patient alone. We would keep them on direct one-on-one care, continuous supervision, even when they're using the restroom, anything like that. We're going to assess the environment where we place the patient with a care provider. We want it to be safe, and we want to make sure that they don't have anything harmful in their belongings. We're also going to assure that the patient's hands are visible at all times, and that we're having someone check in on the staff who's actually sitting with the patient until they're transferred out of our building, making sure that they don't need anything in the meantime. We're going to be contacting that patient's provider as soon as possible to evaluate, and as well as nursing leadership. To get them transferred out of our building, we would call 911 since we are off-site, and then the emergency, they would be transferred to the emergency department. If they would call and state that they were suicidal, we would keep the patient on the phone. We would notify a nurse for assistance, confirm that the current patient location and best contact number to call back. Staff, we would involve the provider and nursing leadership as soon as possible. And we would ask the patient if there's anyone or if there's someone who could come and provide support during this time. We would be non-judgmental, and we would use a very therapeutic approach with them as they're on the phone. We want to always state our intention that we're here to help the patient. We would contact local law enforcement so they could conduct a welfare check for this patient, and we would also document the encounter and any interventions that we took.
Great. Thanks, Becca.
Thanks.